Hi everyone. In light of everything going on with the human coronavirus, we are getting a lot of questions here at Case Veterinary Hospital about how this may be impacting our furry family members at home. And I wanted to give you some information that we as veterinarians are receiving from not only the CDC, but also the AVMA, which is the American Veterinary Medical Association. A lot of this is coming from a case that is being talked about in China. In late February, early March, a dog that was a pet of a person infected by COVID-19 did come back showing weak positive test results from nasal swabs and oral swabs. It's been over 2 weeks. That pet did not come back with any kind of clinical illness. Still being monitored, obviously, very carefully. Also, it is the only pet that they've even found a weak positive with. So there is absolutely no evidence to indicate that this is something that can be transmitted from our pets to us, or other animals for that matter. So even though out of an abundance of caution, the AVMA does recommend that we do take some common sense approaches when interacting with our pets or any other animals in our homes, like service animals as well. Should you become ill with the virus, they want you to tell your public service official or your healthcare provider that you do have a pet in the home and that there is an animal there. Although there have not been any reports of animals becoming sick with COVID-19 or being able to transmit that to any other animals or people, they're just watching that very closely as we learn more about what this virus does. Even though we don't have this in our area at this time, we do want to update you on what we're doing here at Case Veterinary Hospital to keep everyone healthy. Obviously, as a hospital, we are already very accustomed to sanitizing surfaces and disinfecting areas between each and every patient after every service. However, based on the guidelines given that we've all been hearing about, we are doing everything else that includes our people team, like the hand sanitizers, sanitizing surfaces that are commonly used, doorknobs, keyboards, phone receivers, all of that several times throughout the day. We're making sure that our team members know that we do support them staying home if they feel any symptoms. So just rest assured that we're doing everything we can to keep everybody, including you and your pet and our team members, healthy. For those of you, though, that may be immune compromised or elderly or have maybe a chronic illness, we do want to offer to you, if you are so inclined, pet side or curbside rather service for your pet. We can actually come to the car and bring your pet inside for you. Do everything we need to do by phone as far as getting a history and letting the doctor ask you questions and take payment over the phone. So just let us know if that's something you're concerned about and you need to have your pet seen and you'd like us to do that. We certainly can. Just let us know when you call. I do want to say, though, that if you yourself are experiencing respiratory symptoms or have a diagnosis of COVID-19, obviously your pet needs care still, just alert us before you get here. We have been recommended by the AVMA to alert the state veterinarians and healthcare officials if we do need to treat pets that are in contact with owners that may be infected by the virus. So the situation, it continues to evolve, as you all know, and we're monitoring it very, very closely. We do remain open for business. We're committed to you and your pet, so we're here to help. Just ask us what we can do.